Okay. Good morning, everyone. Welcome. My name is Max Latona. I'm the Executive Director for the Center for Ethics and Society at Saint Anselm College. My pleasure to welcome all of you here today to our program entitled Dover Mental Health Challenges and Response, really part 3. This is the third public program that we've had. In today's program, we'll discuss the draft report and recommendations of the Dover Mental Health Alliance Task Force Subcommittee, which have recently been released for public feedback. And if I forget to say so, there are copies of the full report on the table out there, and you're welcome to, we need the microphone? I'm told we need the microphone. I thought you were giving me a power symbol. Okay, so before I introduce our moderator, who will introduce our panelists and begin the discussion, I'd like to take a few moments to acknowledge a few important items. First, I do want to thank the City of Dover for giving the Center for Ethics an opportunity to work with the subcommittee and the community of Dover on this important and timely project concerning the city's response to the mental health needs of the Dover community. Some of you might wonder, well, why did this center undertake this work? I would say that it is core to our mission at the center to help organizations and communities in New Hampshire to address ethical issues that they face and to do so using research and education, dialogue, and collaboration. And the mental health needs of communities such as Dover and our obligations to respond to those needs are important ethical issues. And the center has accordingly made use of all its available resources and expertise in research, student, intern, manpower, or woman power as it is in this case, public surveys, community consultation, facilitated public dialogue, marketing and promotion to help the subcommittee bring this project to a successful conclusion. We have enjoyed the work and are grateful for the trust of the community. Now, speaking of the subcommittee, the draft report and recommendations that we will discuss today are really the product of 4 essential human elements. First, the expertise and hard work of members of the subcommittee. I do want to take a moment to acknowledge who they are. They are key leaders from the health, education, and safety related organizations in the Dover community and people who I know deeply care about Dover. They are Christine Boston, Assistant Superintendent of Student Services in the Dover School District, William Broad, Chief of Dover Police, Stephen Curtis, Director of Behavioral Health at Portsmouth Regional Hospital, Malachi Fisher, Director of Emergency Management and EMS at Portsmouth Regional Hospital, Keith Irwin, Division Chief of Emergency Medical Services at City of Dover Fire and Rescue, Chris Kozak, the Executive Director of Community Partners, Michael McShane, Dover Fire Chief, Alex Matrucci, Dover Police, Kelly Mueller, Assistant Vice President at Wentworth Douglas Hospital, Dave Turlemezian, Dover Police, and Suzanne Weedy, Community Engagement and Education Community Partners at the Dover Mental Health Alliance. So that's the first human ingredient that came into producing this report and these recommendations. The second ingredient, and equally important, was the input provided by so many community leaders and community members in Dover. As I'll note in a moment, we reached out to, consulted with, and received feedback from many people in the Dover community who've either had personal experience with mental illness in their families, or work in mental health services, or work in city departments tasked with responding to mental health needs. And the third human element was the team of people brought this task by the center, which include our wonderful discussion moderator, whom I will introduce shortly, our program coordinator, Hannah Beaudry, our staff at the survey center at the college, our hardworking and talented student interns, Sophia Pajikowski and Anna Jenren, who is here with us today. And a final ingredient I want to emphasize, a human ingredient. Our work is made possible by the Dover City Council and city municipal leadership, who have funded our subcommittee's work and have supported it at every step of the way. One of the best parts of this experience for me was having the opportunity to meet individually with the department leaders in the municipal leadership team, to discuss with them personally how the planning department or the library or human resources or finance or public welfare, et cetera, can help the city address the mental health crisis needs of it. I truly believe, and I really mean this, that Dover is blessed to have some of the finest community leadership in New Hampshire, and that all of them, from the mayor to the deputy mayor and the city council to the city manager and the department leaders, they care deeply about the mental health needs of this community. Now that brings me to my next important point. Our subcommittee was tasked with the following charge: to develop a set of recommendations that reflect trends, obstacles, opportunities and best practices to follow as they relate to ongoing city responses to mental health related calls for services and needs. As we discuss with you our recommendations over the next hour, it's important to remember that whatever needs continue to exist and whatever opportunities we have identified to meet these needs, these should not overshadow the tremendous efforts that Dover has already made in this area. Our recommendations are intended to help Dover continue its excellent track record of success and to continue to serve as a shining example for other communities in New Hampshire. I'd also like to comment on the process that got us to where we are today. The report and the recommendations that we have released for public feedback are the product of an incredible amount of work by our subcommittee over many, many long hours. For almost an entire year, we met every 2 weeks on Friday morning at 8 a.m. We conducted extensive research of local, regional, and national trends in mental health, as well as best practices for addressing mental health needs. We collected enormous amounts of data, consulted with leaders in Dover's mental health agencies and service providers. We conducted public discussions and a citywide survey. And as I mentioned, we met with each of the 13 department leaders to discuss how their department could contribute to the strategic objectives we identified. All of that said, we feel very strongly that the report, while we feel very strongly that the report and the recommendations that we're sharing with you reflect the best available research and data and reflect the needs and concerns of the Dover community, it's important to note that this is a draft. The City Council has not yet had the opportunity to review and discuss it, and we need your feedback on these 6 strategic objectives and the 120 specific recommendations for meeting those objectives. That is the purpose of today's event. So please note that if you would like to email us comments after this event or sometime next week, you may do so at, and there's a sheet out there with this email address, but dovermha@gmail.com. So there's opportunity for feedback, continued feedback into next week by email. And we're happy to receive your feedback and we really want your feedback. And it's our hope ultimately that next week after we receive this feedback, we can revise the report, submit it, and depending on how it's accepted with the City Council, that ultimately the report and the recommendations that we provide will help those who need it. Our sons and daughters, sisters and brothers, parents and grandparents, neighbors and friends who could and do often suffer a mental health crisis. So with that, sorry for going on so long, but I will now introduce our esteemed moderator, Laura Canoy. Laura Canoy is one of New Hampshire's most well-known journalists. She's the founding host of New Hampshire Public Radio's The Exchange, which for 25 years was the state's most widely recognized and respected radio program. And in mid-2001, Laura decided to step down from the host chair to pursue other interests, including writing fiction. Her skills in interviewing, moderating, and public speaking are frequently called upon, including by our center. And she just recently joined the Rudman Center at UNH Franklin Pierce School of Law as its Director of Community Engagement. She's also a fitness instructor and lifeguard at the Concord YMCA. So please welcome Laura Canoy.
Thank you, Max. And thanks to everybody in the audience for being here the Saturday before Thanksgiving. Maybe you went to the grocery store before you came, or maybe you're going to go afterwards. But it's really great that so many of you are taking the time during this busy time of year to be with us to talk about this incredibly important issue. As Max said, our goal this morning is to get your input on the draft recommendations that the committee has put forward. Now, don't worry if you haven't gotten a chance to look them over yet, because our panelists are going to give us an overview of the what, the why, the how of these recommendations. And then we really do want to hear from you, as Max said. If you're here in person, in about 20 minutes, we will start bringing the microphone to you. Anna Gendron from the Center for Ethics and Society will be keeping hold of that mic. Now, for sanitary reasons, we ask that you let Anna hold on to it so you don't have 100 different hands on that microphone. If you're joining us online, put your questions in the Q&A function at the bottom of the screen, and Hannah Beaudry from the center will be coming around to share your questions with the panel. So if you're online, go ahead and put your questions there in the Q&A function. Lastly, I often forget to do this myself. Please silence your phones. You don't want to be that person whose phone goes off in the middle of an incredibly important or moving moment in our conversation. Now I want to introduce our guests. We are joined by, as Max said, 4 people who are deeply involved in both improving mental health in the city of Dover, and also involved in this almost year-long process that Professor Latona described, culminating in these draft recommendations. It's really great for me to see them. They've been my Zoom buddies for a year or so, so it's great to see them once again in person. First of all, we have Dover Police Chief Bill Breaux. He's been with the department for almost 25 years. He's held every rank. He was appointed chief in 2018. Bill has a master's in public administration and is a graduate of the FBI's National Academy. And Chief Breaux, thank you so much for being here. Also with us, Christine Boston, Assistant Superintendent for the Dover School District. Christine has also served as the district's Director of Pupil Personnel Services and as a principal of both the high school and the middle school. And welcome, Christine. Thank you so much. Also with us is Christopher Kozak, CEO of Community Partners, which is the regional provider of mental health, developmental, and family support services. Chris is also involved with a variety of efforts to improve mental health response, including the Dover Mental Health Alliance. And Chris, great to see you again. Thank you. And also with us is Suzanne Weedy, Community Education and Engagement Manager at Community Partners and a founding member of the Dover Mental Health Alliance. Suzanne is also an adult, youth, and teen mental health first aid trainer and a NAMI NH Connect suicide prevention trainer. And Suzanne, great to see you as well. So all of you, and I'll start with you, Chief Breaux, please. What's the wider context for all this work that you've been involved in for the past year? What's sort of driving you or motivating you to engage in this process?
Well, really, can everybody hear me okay? Well, really, it came down to, for us, over the last several years, we've seen an increase. The police department, and not only the police department, but the fire department and our local emergency rooms have seen a tremendous increase in people suffering from mental health related issues. For us, our calls for service, with any reason that people call the police, those numbers continue to go up. The crime involved has remained consistent. So when we started to look into those, why are our calls for service increasing? What we found is a tremendous increase in mental health related non-criminal calls for service. So people aren't calling us because of a crime, they're calling us because they need assistance or a loved one needs assistance or they're concerned about somebody in the community. And we've seen a tremendous increase in people suffering from suicidal ideation. We have since 2016 a 100% increase in the number of suicidal subjects that we've interacted with.
Wow, sorry to interrupt. Say that again. That's amazing.
Yes,
Yeah.
100% increase since 2016.
Wow.
So, and we see this not only in suicidal subjects, but in calls for police assistance that are non-criminal. You know, nobody calls the police to say, hey, I'm suffering from, or very few people call the police to say, I'm suffering from a mental health crisis. They call us because they may be involved in some sort of domestic disturbance, but the root cause of that is somebody's mental health, either their child's mental health or their partner's mental health, or they're concerned about a neighbor or somebody that they're driving down the street and they see somebody clearly suffering from some sort of crisis. So we've seen an escalation in those calls for service. And really, up until February of this year, our only option was to bring people to the emergency room. And you know, people boarding in the emergency departments, waiting for psychiatric beds or additional assistance is really troubling. So we looked at that, and from the police chief's perspective, I looked at it and said, we have to really do better. You know, this is what our officers are dealing with. We need to make sure our officers are trained properly, but we need to put things in place. And it quickly became apparent to me, this isn't just the police department's issue. This is really a community-wide issue. Mental health affects everybody. It's not just the officers who are dealing with individuals in the field, but mental health affects family members, it affects other loved ones, it affects employers, it affects the school. Mental health is a community-wide problem, and we really need to do a better job addressing that, which is why the city reached out to Dover Mental Health Alliance. I think we have a lot of, like Max said, we have a lot of great things happening here, and we really had the opportunity to leverage some of those great things that are happening to really do this deep dive into how can we do a better job.
Wow. Yeah. And Christine, to you too, what sort of pushed you or motivated you to get involved in this process, to get involved with Dover Mental Health Alliance, and to say, as Chief Breaux said, okay, we're doing great things, but we need to do more?
So, you know, I would basically say ditto to what the chief said. We are seeing the same increases in terms of suicidal ideation, students experiencing a significant mental health crisis. You can't learn when your basic needs aren't taken care of. So we need to address that as a school. For me, it's really a matter of, we keep pulling, I always use a river analogy. We keep pulling kids out of the river downstream after they've fallen in. I want to keep them from falling in the river to begin with.
Yeah, we were talking before our program began today about just a couple trends that you're seeing, Christine, in the schools.
Yes, so recent YRBS data from 2021 shows in high school students, about 59% of them report feeling hopeless or sad at some point in the last, I believe, 30 days. Only, let me put it this way, 36% of them report they've not received help for that.
Yeah.
We have a student body of 4,000 kids. That's a lot of kids reporting not receiving help just at the high school level. Our suicidal ideations for last year in total, and these are only in-school reports. These do not include, I take my child to the emergency room outside of school hours. This is just when school staff intervene. Last year, we had 59. As of yesterday, we had 31.
Wow, and YRBS is Youth Risk Behavior Survey. That's where
Yes.
some of this comes
Yes,
from.
sorry about that.
Right, no, that's really okay.
We love an acronym in education.
That's okay. Chris, I'll turn to you as well. What is sort of pushing you to, again, you're already doing great work here in Dover, but to do even more, to launch this effort and to stay so engaged in it?
You know, beyond what you heard from Christina, the chief, I go back a few years to the kickoff of Know the Five Signs with Justice Broderick. I was in Concord before that, and it was beyond his speech being moving and powerful. If you haven't seen him, I take the opportunity, but it really confirmed for me that mental health affects all of us, either directly or indirectly, from somebody we know or somebody we love. And we keep hearing, you know, the figure, which is, you know, 1 in 5 adults, but that's at any given time. And so you take that 1 in 5 across a year, and you may be something more like 4 in 5 adults are impacted, right? So the 1 in 5 is a snapshot. It's not over time. And then I started looking at how people respond and relate when the subject of mental health comes up or mental illness comes up. And even the nuance between mental health and mental illness will bring up different images in people's head, right? When you talk about mental illness, they go to a psychiatric facility or a straitjacket or some of those, you know, images. When you talk about mental health, you're in a different realm now, and you're talking about somebody who might be struggling or somebody who maybe is mentally healthy. And so our words make a difference. And it strikes me that if in any community, and we're talking about Dover now, so if in Dover, we all understood that a mental illness is a health condition the same as any other health condition, then we can better accept it and learn how we can help people through that. And in the past year, and we'll probably get to this later on, but we've brought on a bunch of peers on a mobile crisis team. And the power of the peer to interact and work with people and connect with them shows that you don't always have to have that licensed person working with you to work through some of the challenges that we have in life. And if all of us, if you will, could become a peer at some level, then we get rid of the stigma. And what I like to really call it is discrimination, not stigma, because that's what it is. And we probably will have the resources that we need then to serve the community. So that's my tip.
Well, the stigma works with exactly what your focus is, Suzanne. So what efforts are already ongoing in Dover aimed at this issue? Because you've been widely involved.
Thanks. Yes. Well, I just have to take it back a little bit though, because we have the chief, we have the assistant superintendent and CEO, and I am a mom. And I'm a mom that's really passionate about our children in our community and the things that they need. And we've had a lot of tragedy in this community. And as a mom who's very, very involved with their parents or with their children and the things they do, if I don't know what the signs and symptoms are, the warning signs of someone with emotional distress or potentially suicidal ideation, there's got to be a lot of other people out there that don't know. So that's really the impetus for me, for other parents, business owners. It doesn't just affect families, business owners with employees people need to understand what the risk factors are, and warning signs of someone who might be having an emotional crisis, and then know what to do to get that person to help. I'm not a therapist, but I do have some tools in my toolbox to be able to recognize and then respond appropriately to someone. And those are the things that we're trying to do here in the community, is to teach not only the professionals that are in the biz, but the people like my peers, my other colleagues, my friends who are parents, new parents, business owners. What we're trying to do is across the board, as much as we possibly can, is teach people what those warning signs are so they can recognize when someone is in emotional distress, respond appropriately, and get the person help. Because if you're in a mental health challenge, you don't want that to move into a crisis situation. So let's stop it before it turns into a crisis. And then that takes, hopefully, the idea of the burden off of the first responders and the reactions of, what happens maybe in schools or the community mental health centers. So if we as a community can embrace that this is a health issue, and we can understand and learn a little bit more about it, remove our own personal stigmas, then we'll be able to help people actually get to that crisis situation. And I just want to echo too what Chief Bro said. This is a community challenge to solve. The police can't do it alone. The school district can't do it alone. Community mental health centers can't do it alone. We as a community have to come together to be able to recognize this, that this is a challenge that we all face from time to time, and that when we can understand how to actually respond appropriately to it, we can actually help someone and potentially even save a life.
Well, and talking about making the wider community aware, Suzanne, that's the work that you do, education, training, community engagement. So looking at the draft recommendations themselves, education and training are pretty high on the list. So Suzanne, why are these so important?
I think it goes to what Chris was saying, is that to take it another step too, if people don't understand something like, say, mental illness or what a mental health challenge is, they're fearful of it, or that's when their stigma is about what mental illness is high or apparent. You know what I mean? So if people understand that these are health issues, people can recover from mental health challenges, people can live with mental illness with proper treatment and care, they can lead successful lives. But if people don't understand that and are fearful of it, then you're going to continue to perpetuate that stigma. And that then makes it so people who are having challenges don't seek help.
Well, in a few minutes, we'll start taking your questions. So don't be shy, because we will start going to both our in-person audience and our online audience in just a few moments. But I do want to spend just a little bit of time talking about the recommendations with all of you. And in terms of the work that you do, so schools for Christine, police for Chief Bro, community outreach for Suzanne, mental health services for Chris, which recommendations could have the greatest impact right now for the least amount of investment? This is the low-hanging fruit question. And Christine, can I go to you first, please?
I think education and communication, by far. We've seen great results with training, suicide prevention training, the NAMI Connect training. I'm also a trainer. The student mental health first aid, training students to be responsive peers to their own peers. We've seen great results from that. So I think those are the low-hanging fruit, just to continue the efforts that are already underway. And I'll give you an example of that. We do NAMI Connect training for all our staff, 2 hours a year. We had a new staff member last year who received the training. The next day encountered a student, normally would not have asked the next question, but did ask the next question. Are you thinking about hurting yourself? Student replied, yes, had a plan. Had that gone without any intervention, it could have had a very different outcome. Student got help and support and was able to return to school successfully.
Wow, that shows the power of training right there. And it's a 2-hour per year training. It's not a big ask, but it makes a big difference.
No, and it gives staff the knowledge of, not only do I know what to say, and I don't have to be afraid of what I'm going to say, creating an issue, but I know how to respond when that student says yes. I know what to do next. I don't have to fix it. I just know the next person to get them to.
Yeah, it's a
Very
powerful
powerful.
story. Yeah, Chris, how about you? In terms of these recommendations and in terms of the work that you do, what's the low-hanging fruit? We'll talk longer term and harder later, but let's start with easier.
I agree with Christine. I think the low hanging fruit is education. The more we're aware and the more we learn how to talk about this and understand that it's an illness and that we're not, it's not a scary illness. It can be scary because, you know, it can be life and death, and that's scary. But the person is not scary. The income, the outcome that is potential might be scary, but the person himself isn't scary. And I think so that education and that understanding can really go a long ways. The other thing you'd ask Christine, that was low hanging and low cost. So the low hanging is clearly education. That's also the low cost one. But I think the other piece is, and I know that no matter where you are, we've all got workforce challenges right now, but the people going into the mental health field right now seems to be dropping off. And so finding ways to support that and make that a viable career option for people so that we have more resources available, I think is also important.
Right, encouraging people to go into the mental health field. Go ahead, Chief Bro, low hanging fruit.
I would echo what everybody else said, education, I see it from the police perspective of how do we get people to understand the signs of somebody in mental health crisis before that 911 call needs to be made. If you think about this, because it's just health. If we do a great job of telling people, if you're having chest pains, go to the doctor, right? Don't wait till you're having a heart attack and you can't move off the floor, right? We need to almost take that same approach to mental health and have people understand the early signs and symptoms to seek help. So, then they don't get to that crisis point where their only option is calling 911 or going to an emergency room. There will always be those people that are in that phase, but how do we do a better job of getting the message out and getting people and the community educated? And a big part of it is stigma, seeking help, and not being afraid to seek help when you need it or a loved one needs it, but also having those difficult conversations, whether it's with students or with loved ones, or, we see a lot of elderly people suffering from mental illness. This isn't, this is across the board. It's across all ages. It's across all walks of life. So, we see it with the elderly people, and, that's a difficult conversation for an adult to have with their elderly parent, that you're not okay, and getting them help. So I think, again, it's education. It's the low hanging fruit. And I think it's the simplest thing to do, but I also think it may have the biggest impact.
Suzanne, go ahead, and then we'll go to our audience.
I just think too, in terms of low hanging fruit, I agree with training and education, but really it's a personal investment of time. Because some of these trainings take a little bit of time, 2 hours for the school district, or 2 or 3 or 4 hours, depending on what module you'd like to do for suicide prevention. And other trainings might be a whole day. So really the low hanging fruit is our personal responsibility in saying that I care about this and I take the time to do the training, because we have trainings that are being offered for free for the community. So that's, for me, one of the lowest hanging fruit.
Right. So do you find, Suzanne, people, saying, sure, training sounds great, but I don't have time today. I don't have time next week. Also, sometimes employers, everybody's short-staffed. Employers say, I can spare you maybe next week, Laura, but not today. So
That's exactly what
tricky.
happens.
Yeah.
It is tricky. It's tricky for, definitely for employers, especially if you have shift workers.
Right.
Or contracts. That's really tough. So how do small business owners put their employees through training, but then they're not on the floor doing their job, and then how do they pay? It's a tricky situation, but that's when the shared community responsibility has to come into play, where people say, this is important to my business, to my employees, to my students, to my staff. We need to make this happen. We have to figure it out, and we have to do it now.
So again, we talked about low hanging fruit. A little bit later, we'll talk about higher up fruit that might take a little longer, it might be a little harder to pick, but I do want to go to our audience now. And again, it's great that you all turned out on a Saturday morning. Thank you. Now that you've heard a little bit about the draft recommendations, maybe you got a chance to glance at the sheet that we passed out. Which ones seem important to you? What questions do you have about the recommendations? Again, if you're part of our online audience, welcome. Put your question in the Q&A function at the bottom of the screen. For those of you here in person, please just raise your hand and Anna Gendron will come to you with the mic. A reminder to let Anna hold on to the mic, please. So thank you for your understanding around that. So oh, good. We don't have a shy audience today. Thank you. Good morning. Thank you for being here. Go ahead.
Good morning. My question is two parts. I'm looking at the number 5, significant barrier, which is the absence of a dedicated facility. First question is, are there facilities locally or maybe even not locally that are doing this well right now that you could look to as an example or a model for what you would envision in Dover? And then the part 2 question to that is, what could or would a facility like that in Dover supply and look like and provide to our community?
Oh, great questions. Yeah, Chris, I'm gonna throw the first part to you.
I was gonna throw it to Suzanne.
This is definitely something the committee talked about a lot.
Yeah. So in New Hampshire, Manchester has a program, has a crisis bed or crisis beds. In the mental health 10-year plan from the state, they called for more than what we currently have available. The idea of a crisis bed or a walk-in is it's a 24/7 location that people can bring themselves to. It's also a place that police or fire could bring people to who don't actually need hospital level of care, but do need to be monitored. And it's it ranges, but generally the facilities are kind of open places to just have support and be monitored. So you're not going to have a lot of medical staff on hand. If you need medical staff, then that's not the appropriate setting. I don't know Manchester's numbers, so I can't speak to how often it's used versus a hospital. We did talk about it at the committee, and the challenge, of course, is, as with many things, finding the funding for such a program, and then a location, and then in our past couple of years, as we all know, staffing would be the next issue. And I don't want to discount that. I think we could probably locally find a way between Wentworth Douglas Hospital and Frisbee and community partners to find a location and do some funding and some grant raising to stand something up. The challenge I think right now would be staffing that. I was on a call earlier this week. New Hampshire Hospital has closed 2 units because they don't have enough social work staff or nursing staff. And as much as the state took over Hampstead Hospital, since they purchased Hampstead Hospital, they're still not running at capacity due to staffing issues. So standing one up might be easier right now than staffing it. And of course, to really fulfill that 24/7 staffing is critical.
Wow, that gets to what you said earlier, Chris, about one of the possible initial steps that you might want to think about is just encouraging more people to go into this field. What has Manchester seen in terms of impact with this dedicated facility? Thank you so much for the question. It's a big issue. Yeah.
So Manchester's been, if you will, the gold standard in the state. They were one of the first ones, and I don't remember how or why they did this, but they were the first ones with a mobile crisis team. They also continue to run something called the Cypress Center, which is technically a hospital, but it's not in a hospital setting like New Hampshire Hospital. Their DRF, which is a designated receiving facility for anyone who's gone through or knows somebody who's gone through our IEA, our involuntary emergency admission process. You go to a DRF, and so Cypress Center is a DRF, but they're in a larger community, Manchester, and so they've had a larger continuum of services ranging from outpatient all the way to Cypress Center, and included in that has been their mobile crisis team and other programs. So it gets used prior to the mobile crisis program that the state launched. They had their own program running. They were pretty tight with Manchester Police, and some of that has changed, and they're working their way through how that program works. But they get a fair amount of walk-in activity that goes on there. And because of Cypress Center, which is already a 24/7 program, they've got staffing who are available to manage that and run that.
Chief Rowe, your thoughts on this idea of a dedicated facility here in Dover?
I think it's definitely needed. One of the concerns obviously is we're not alone in this. Dover's not unique to this. So if we had a facility here, there's no way to say, oh, only Dover residents. So it's kind of like you build it, they will come, obviously, because there's such a unique. So I think it's important to understand this is not, although we're looking at it from how can Dover be better, this is a statewide and a national issue. And I really think, one of the things that we actually recommend is that, through our city council, through our state delegation, we keep pressure on the state to implement their 10-year plan. I think that, a big part of this is if one community tries to tackle this, we'll just be overwhelmed with trying to help everybody. It needs to be addressed on a much larger scale for it to really work. There's absolutely a need, and I support it here in Dover, but my concern is it wouldn't work if we're the only ones doing something.
So that concern or that push is embedded in this whole draft report that the state also needs to fulfill its obligations under the 10-year mental health plan that was released just before the pandemic, I believe. Christine, do you want to talk a little bit about these sort of outlying responsibilities, the state, the nation? It isn't just Dover that needs to, weigh in here.
No, it isn't. And when we look at PrEP programs for social workers, psychologists, things like that, there aren't enough candidates in programs now to fill the need coming up. So we know we have, I'll call it a pipeline issue. So we need to work harder to attract people into those fields to help them fund that. It's not inexpensive to become credentialed and certified and do the internships and the clinical work you need to do to become certified. So there's that piece that would help us in the future, but we need to bridge the gap now as well. That's where I think the community education helps, because you don't always have to be a trained professional to be that person for somebody else. So it's really a multi-pronged approach at this point.
It's such a good point. Thank you for the reminder. And that goes back to you, Suzanne. Maybe you don't have to be a, ultra certified, mental health professional, but you can do your own part by participating in some of these NAMI trainings and some of the DMHA trainings.
Absolutely. And if someone had a broken arm, you're not a doctor, you still would take some steps to help that person, right? Or if someone fell from a heart attack or had diabetes, you're not a doctor to train, to help them with their situation, but you know what to do next to get them to the next level of care, right? And you're not afraid of that because it's a health issue. We need to have the same attitude regarding mental health.
I'm so glad again that you asked the question, because that is an issue that the subcommittee definitely talked about. Other questions from our audience about these recommendations? Yeah, go right over here.
Hi.
Yeah, thank you for being here this morning. Really
Yeah.
appreciate it.
It's great to be here. Great. I was wondering if the 988, the new crisis response number, has had any kind of that mitigating kind of aspect of just people not calling 911 right away, or even if it's helpful for the schools to just have that interim kind of resource to call to sort of help with what should we do? What's going to be so can you speak to that about the new 988 number? Is it having its impact?
Yeah, I'm so glad you asked that question. And before you answer it, just briefly tell people who might not be familiar with 988, what that is. Yeah, go ahead, Christine.
Do you want to speak to
Or
that?
Chris, yeah.
I'll speak to IRA, then I'll throw this over to Chief and Christine. So 988 is a national number. It was stood up, came live in July of this year. In preparation for it, New Hampshire stood up what they call the access point, the rapid response access point. It's a toll-free number to call. And it starts with a over the phone, if you will, a triage and referral model that also if there's a need for immediacy, that if the situation's safe, they can actually dispatch a crisis team from any one of the 10 mental health centers out to that location to do some intervention on site. If there's a higher level of need, there's also the ability to dispatch police or direct to go to the local emergency room still. So that was our local in January. July it went to 988. So any of you who happen to have a 988 prefix, I know down in Portsmouth there is. That is the reason that all of us need to dial 603 before anything now is because New Hampshire is one of the few states that had a 988 prefix that kind of forced us into that direction. As far as the numbers, I'm going to let Chief talk about if he's seen any decrease in 911, but I know heading into this, the belief was in the first year anyway, we weren't really going to expect to see a large drop off in 911 calls. And as the Chief said earlier, people aren't calling 911 saying I'm having a mental health emergency. Usually it's something else. And behind that is a mental health crisis or situation. So I will say, though, that 988 is getting a lot of use. There was an early debate in the contract between the state and the vendor, Beacon Health Strategies, about the number of calls, and they kind of had this number of 20,000 for the first year. They're trending now at around 50,000 calls going on, so it is getting used. There's a lot of triage going on. There's I'm trying to remember the last numbers I saw, but there's been around 2,000 dispatches out of that. It's hard to decide if you're diverting somebody from a hospital or not. I'm sure the state will have numbers in that. But it's really, you're guessing as to whether that person would have gone to the hospital or not gone to the hospital, just continued suffering with their illness. You don't really know what would have happened with that. So there's some guessing that goes on with that, but the number is definitely getting used. And we are seeing a lot of clients in-house. So when you get the call in, if it can get resolved on the phone, that's great. But there's also this referral piece that comes to us, and we will do an outreach. We've got staff on 7 days a week. So we're going to do an outreach, and we're going to offer you an opportunity to come in and connect with us within 24 hours of you making that contact. So that's something new for us that we haven't had before. There's usually due to staffing and other things going to wait, but people who have contacted them, we'll get you in right away, and we can work with you for up to 30 days. So
Wow,
sorry about being long-winded.
No, it
but,
sounds like it's relatively new. We just started in July here in New Hampshire, and people are already using it. So
Yeah.
that's fantastic. Do you have the staff to do the expected piece that you described?
So it's supposed to be 24/7. We do not have 24/7 staff, but in previous, so looking back over our data previously and looking at the calls that we have overnight, which is not a lot, it averages somewhere around 1.2, 1.3. We've decided to take our limited resources that we do have, and we're putting them in the daytime hours where we have a large volume. And really that, after school time, starting around 1 or 2 o'clock up until about 8 o'clock at night, we have a large number of calls coming in then. And so rather than stretching our resources to cover into the overnight hours, and then let somebody, not have a need met when we have a higher volume, we're kind of pushing our staff that we have right now into those. And when we get fully staffed, we'll stretch the forward.
Sure. And I think a lot of businesses and organizations are making similar decisions, strategically. Christine or Chief Broda, do you want to talk about 988? Christine, yeah, go ahead.
So there are a couple pieces with 988 as far as the school. And I think one of the most important pieces is, as of this year, every student ID grades 6 to 12 now has that 988 number printed on them. So it's readily accessible to students. So I think that is going to be helpful. That is new, so I don't have comparative data to show, and I don't have the 988 data anecdotally. It's helping to have that number out there for kids. I would say what Chris was talking about, the mobile crisis unit, has been very helpful. We've gotten very positive reports from parents who've used that. They've responded to the school for us. It gives, at least another level that's not necessarily calling police and fire. They don't necessarily need that, but they need more than we have as a school. We don't necessarily need to bring that child to the emergency room every single time. So it gives us just another level of intervention without escalating more than we need to. So there's huge benefit in that piece for us.
Yeah,
Oh,
and
that's great.
I love that you have on the IDs. I didn't know that.
Yeah.
The other thing with 988, I should have mentioned this, and when Christine said this, it struck me. Sometimes it's hard to make a phone call. And so the 988 platform also allows for texting. And so, and I think about this with students in particular, you can be in class. And I'm sure they're not supposed to use their phones in class. I'm sure none of them ever do use their phone in class. But should they do that, you can be in class and feel distressed. And if you know that 988 is there, you can actually text somebody and say, I'm not feeling good, right? And you're gonna get that engagement going and you can follow it at your pace. So it can be during class, between classes, but that outreach can start very secretively. You don't have to be on the phone someplace with somebody overhearing, but you can start it that way. And then it can continue when you're at a place to get to a phone. So I'm happy that it's like,
It's on there, and I personally do this, and I know a number of our staff do. I have the text line, I have the Trevor Project line, I have 988 right in my email signature.
Well, neither of my children have ever texted during class, so.
don't have money.
Other questions from the audience? I'm so glad you raised 988. That's really important context for this conversation. Yeah, go ahead, sir. Thanks, Anna.
Hi, as a member of the school district and as a school psychologist, I'm intimately involved with these kinds of things. There's a couple of sort of questions, points I wanted to make, and one of them, there's a graph on page 21 of the report that shows the substance abuse, mental health, drug abuse statistics, and I know we all know, but I'm not sure that I've heard it or seen it in the report, and I haven't read it in detail, but these are often co-occurring so that they're all connected, and that the treatment, we've talked about mental health, it's a chicken and egg sometimes. We don't know really what's causing, but that it's so important, especially with the youth that I work with, that these are recognized because and how we approach that. The other point or question I have or concern I have is I don't see immediately in the report how important prevention is. So we educate people about how to access help when they need it. And I know there's a big push in our district for social emotional learning that hopefully can help with mental health. The problem, and this is the high hanging fruit, is funding, because we're working on this through grants, and these aren't going to last forever.
Right.
But we treasure math, reading, writing, vocational education, and I totally support that. But if you're not healthy, you don't access those things either. So how we, do mental health, and how can we do that? And how can we change the culture of the state, in our country, in our world, about that part of education is just as critical and just as worthy, and it's expensive. And how do we do all of that?
And before we go to the panel, so we're focusing on the draft recommendations. Hang on, Anna, stay with him for a second. So in terms of the draft recommendations, are you saying you'd like to see more emphasis in these recommendations on prevention?
Yes, yes.
Yeah.
And yeah.
And in terms of the substance abuse and mental health issues, I mean, you're right. It's hard to know what came first. It's often co-occurring. Would you like to see more emphasis on that in the recommendations, or is that just a more of a general thought?
I haven't thought that.
Yeah, that's okay. Yeah.
And I like that we have an opportunity to read this and then maybe email and get connected that way.
Right, absolutely. Yeah, great point about prevention, but also to his point about, some of you may need both online and here may need a little chance to digest this. Suzanne, people can send emails to the Dover Mental Health Alliance if they want to look at the recommendations more deeply and follow up. Correct? Yeah.
MHA@gmail.com. Please
Okay.
do send your questions or comments, and we'll be collecting those over the next few days.
Right.
Next week. Yeah.
What about prevention, though? That's a really great point, and making that a little bit more of an emphasis here.
So I was thinking when Peter was asking that question is, to me, it really still comes back down to education. And right, if someone has a mental health illness or a mental health challenge or an illness, then you're there, right? So then how, as we as a community, as society, start talking about those root causes? And so we've also done a lot of work with this organization called the Pine Tree Institute to talk about adverse childhood experiences. They could be one of the root causes of why someone develops a mental health challenge or mental illness or substance use disorder. So a lot of people don't know what adverse childhood experiences are. And it's a fascinating study that was done, and it talks about how chronic childhood trauma rewires the brain. So people, I'm not a psychologist, you really should be talking about this, not me. But what I'm saying is that adverse chronic childhood trauma rewires the brain, that's my understanding, and so that people might be more susceptible or at risk for mental health challenges or substance use disorder. So that's a bigger can right there, because then you have to start thinking about how do you tackle adverse childhood experiences so they don't happen in the first place.
Right. Chief Bro, I can see you want to jump in. Go ahead. Yeah.
Yeah, no, I think the point about prevention is and grants. It's very spot on. I think here in Dover, we are doing some prevention efforts. In fact, we just last week, the city council approved a grant that we received to work specifically in mental health with our youth prevention efforts. So we have a youth-to-youth program, which has historically been focused on, substance misuse, tobacco, alcohol use. And it's really the model behind the program is, we use older kids to kind of relay the message to younger kids. This grant will allow us to work with community partners and NAMI and other organizations to really implement a mental health part of that curriculum. So I have older kids explain to younger kids the importance of mental health, the importance of stigma reduction, but also understanding some of the science in languages they can understand at an early age. I think we are doing some things, and it's we're kind of flying the plane as we build it here too. So there are a lot of things happening in Dover. We have a social worker embedded with the police department now that started under a grant in February. I'm happy to announce part of that same grant that the city council agreed to last week. Funds her for the next 5 years, which is huge, and actually helps us bring on a second social worker. But one of the things that she's launching with the schools is a ACE, or adverse childhood experiences response team. So, the police department deals with people in all kinds of situations. Domestic violence is one of the things we unfortunately have to deal with a lot, but there's often children involved. They're affected by that. So our response team, the officers will identify when children are present. And I'm just using domestic violence as an example, but there's a whole host of times where it comes in. And our social worker and partners, a police officer and partners in other social organizations, well, community partners, Waypoint, whatever the specific need might be, will then go out and reach out to that family. And really, the hope there is to prevent that child or that experience from becoming too traumatic, or to having that child develop mental health issues down the road because of that experience. The sooner we can get involved time-wise to that experience, the better the likelihood that we can prevent future problems.
That's
So
rewiring that Suzanne
I-
talked about.
I
right?
agree with you. Prevention is a big part of it, and I also think it really dovetails with education.
Well, and the gentleman asked about high hanging fruit, which is a great question. So thank you. So among these recommendations, and I'll just go down the line, you first, Chief Bro, please. What's the high hanging fruit that you would love to see happen among these draft recommendations?
I thought about that question quite a bit. I think they're all equally important. I really think it comes down to a cultural change. Anybody that understands how to change culture, it doesn't happen overnight. And it's not just one thing. There isn't a magic silver bullet that's going to fix the culture. I think it takes culture within organizations, the police department, to focus on mental health. And I think we're slowly getting there. It takes communities, the culture change in the community to understand mental health and to not have stigma associated with mental health, to treat it like a health concern, like you would any other health concern. So for me, I don't really have one specific thing. I think, certain things are going to be more difficult and more expensive and come with more challenges, like a facility. But I think overall, they're all super important and they all play a key role. And I think Christine used the term, it's a multifaceted approach, it's a multi-pronged approach. We have to look at it that way. Not one thing is more important than the other.
So the facility, the dedicated facility we talked about earlier, that's higher hanging fruit. It's great that your police social worker got extended for another 5 years. She has plans she'd love to have a couple more people with her doing that important work. So that, I'm guessing that's another high hanging fruit, is another police social worker.
Correct. In fact, we are going to be posting for a position to try to hire somebody. Now, whether or not we can find somebody, might be different, but to bring on a maybe not a master's level social worker, but a bachelor's level social worker to do more of the outreach. So what we're finding, Katie Jones is our social worker. She's an MSW, a master's in social work. She's kind of has two roles. One is doing the case management with people that have the officers have dealt with, that she interacts with, and that need help and want to receive that assistance. But the other big part of it is we deal with a lot of people, the officers deal with, and then we go back out to try to offer help. And, you know, that's a big time consuming process. And unfortunately, we can offer help. Not everybody's ready yet to receive it. So, you know, we found that she's limited in the amount of time she can actually manage cases for people that want to receive help, because we're out trying to offer help.
So she had another person backing her up.
So the thought being that, you know, a bachelor level person could come in and be more of that, go out and offer the assistance.
Right. Christine, high hanging fruit that you would love to see in these draft recommendations. It's your chance.
You just checked one of them off with Caitlin, like that took one less reason for me to be up at 2:30 in the morning off my list, so that's fantastic. I would say it comes back to human resources, because when someone's ready for help, the right responses come on in, not I can see you next Tuesday for 20 minutes, right? So I would say staffing, that is going to be a funding challenge and also just a staffing challenge, given the pipeline issues we're having. We would like to see our mental health staff within recommended ratios. And right now they are not, they're outside of that. For example, our school psychologists really aren't able to do much more than evaluate students for special ed plans. So we would like to have more psychologists, more social workers, more tiered interventions, if you will. I would say the other high hanging fruit is just funding. Our multi-tiered systems of support programming right now is very much grant funded, and that grant is going to sunset in September of 2024.
Oh, wow. Okay. Chris, go ahead, your turn. We mentioned the facility already, but other
Yeah, I
high
mean-
hanging fruit that you would like to put forward in these draft recommendations.
I agree with the chief. You know, the high hanging one is really the cultural change, and hopefully with the cultural change, you know, do you need the facility or not? There's some great programs, and I'm trying to remember if this was in Australia or UK, but it was like the open park bench or something like that, and they had trained people who would just hang out in the park and sit on the park bench, and other people would come up and sit down, and they would just start talking. And you know, they're not trained, they're not professionals, they're not licensed people, they're more peers. But that worked, right? It reduced trips to the hospital, reduced the need for mental health services. And so I think when you look at that at a community level and what can be done without having necessarily licensed people or fully trained people, but just people being open to having that conversation, you start changing the dynamic. And so, you know, maybe we still need the facility, maybe we don't, but you know, I think that's the high hanging fruit in my head of that cultural shift of where we need to get to. So that, you know, when it's the homeless person that you encounter, whether it's the person who is having a very interesting conversation with themselves or with somebody else who you can't see, we're not put off by that or frightened by that, but we find a way that we can engage with them and see if they would like assistance or not. That kind of acceptance and willingness on the part of all of us will go a long ways in changing the path for anybody who's experiencing that, because they won't feel as outside, they'll feel a little more accepted, and that will go a long way.
Go ahead, Suzanne, please, and then get your questions ready. Okay, go ahead.
I agree too, regarding the culture change. When the Mental Health Alliance started, say in 2019, that's one of the first things we said, like, we are looking for a mental health revolution. Like, this is a cultural change. It's not going to happen overnight. It's going to take many, many, many years. So I agree with that. And that again comes back to the shared responsibility of our community members to make the investment, make the time to learn about things, come to training, open your heart, become accessible, that kind of thing. But in terms of high hanging fruit, and I don't even know if this is high hanging, just because I was really impressed with the answers we got from the city leadership in Dover with what they wanted and what they needed within their own departments, is but we really need our leaders to be on board, our state legislators, our congressmen to be on board, to get their own education, to be part of the solution, to understand what the needs are within the community, what individuals need. But we really, really need the leadership within the state, within the municipalities, be a part of that. And fortunately in Dover, I mean, you see the people here, I think we really have that, but that's not the case everywhere. But not only just at a local level, we really need to look at it at the state level and have our leaders be part of that solution.
Well, again, if you're part of our online audience, put your comments in the Q&A function at the bottom of the screen. We're getting great questions from our physical audience here. If you're online, we welcome your questions as well. Other people in the audience today. Oh, great. Lots of people. Anna, how about this woman in the blue sweater? And then back there in the back. Thank you.
Hi, thank you. Kind of nervous here, but I'm very familiar with the issues of substance use disorder out in the community and make myself involved. I'm a person that would be on the park bench, and I'm fine with that. What I'd like to say is that I see one barrier to help as being Medicare disability and Medicaid disability. I'm fighting those organizations right now for help. Medicare disability for those people under the age of 65 with disability have no middle ground. They have a small window of detox in hospital allowed, 7 to 10 days approximately. And then they don't provide any residential treatment after that, meaning a 28-day dual diagnosis treatment. This substance use is a disorder. It's a brain issue. And the other piece is that when you try to find other resources and you go to Medicaid, Medicaid will help with the extended program if you're low income. But the only thing you can do if you have Medicare disability is you can fight for aid to the permanently and totally disabled, which to me is a horrible term. You can drop it if your person ends up finding recovery or becomes healthy. You can drop that. But I've been fighting this for a year now.
Wow.
Appeal after appeal and hearings. And so my thing also, and I'm afraid to say this, but I'm going to say this. I belong to NAMI. I am involved in NAMI groups, mostly in person, not real comfortable with the video thing. But I also wonder about NAMI and that stigma. And I love what, I think it was the chief that said stigma/discrimination, because I see Medicare, if Medicare decided not to discriminate and would actually allow people that 28-day period, if I had a broken hip and was in the hospital,
You'd get covered. Yeah.
Oh, you're discharged, you're going home. Well, how do I go home? How do I walk? But if you have substance use disorder, you're in your detox, then they say, oh, you're going home. You have all these medications. What then?
Let's
So
talk about that.
The other piece
because,
that I just
yeah.
want to quickly say about NAMI, I'm sorry, is I love it. I think they do awesome work, but I also don't fit in often. Because I can relate to the psychosis, I can relate to all the mental health issues that come along as a child and move forward in the progression towards substance use disorder. But if I talk about substance use disorder, I don't feel as if I fit in with NAMI.
So
Thank
two big points. No, thank you so much for being here. And Chris, I'm going to turn to you. You know, she's right. The whole insurance piece and getting coverage for services is a big mess and can be very difficult for people. So I'm sure you're not the only one that struggled with that. Is this even something that the city of Dover and these draft recommendations can tackle, or is that sort of a whole nother piece of this that is more up to the state and the federal government?
Well, so that's, thank you for that and good question. Medicare is a federal program. It is the behemoth. There are many rules within Medicare that do not really make a lot of sense when it comes to behavioral health services. One of them that's just a peeve of mine, and I understand it completely on the medical side, is there's something that if you are, you may be at a, say, Tufts University Medical School, right? And you are a resident. And so you're providing services in order to bill Medicare for those. There has to be something known as a doctor on site, right? Who's overseeing, who's available should something go wrong. And I understand that in a medical realm. They also apply that to behavioral health services, mental health services. And so you may be a therapist who's working towards your licensure, but there has to be a psychiatrist on site, physically on site, should something go wrong. And I'm not sure what a psychiatrist is going to do if something goes wrong. It's not like even if they were to medicate you, assuming that's even appropriate, which it probably isn't, it's going to have some immediate impact. So it's not like they're very different, but the same rules apply. So Medicare is filled with rules and coverage limitations that don't make a lot of sense within the mental health system. In the Medicaid world, which is a combination of state and federal, if you are in Medicaid, then and at a mental health center, you can get case management services covered, you can get community-based services covered. Medicare, not covered at all, right? That's not going to be part of the mix. So it's a behemoth. There are some antiquated rules. I would say that there's probably some discriminatory policy that goes within there, but probably not going to be changed through anything that this report is going to do. But it is something that I know that we, through our association and other vehicles, talk with our federal delegation on a regular basis about some of these antiquated rules and processes. And
Right.
I think we're getting a little traction on some of this, but not quite there yet.
Well, and that shows how large this issue is. I mean, the subcommittee and the committee were tasked with finding recommendations that Dover itself could do right now. But you're so right. Dover is operating within this giant, system where there are all sorts of rules and regulations that sometimes don't make sense. We had someone in the back.
Before you go off to
yeah.
another question, because come a couple of times the co-occurring disorders, and it is and I think the way you phrased it, whether it's NAMI or anybody else, I think that I have a mental illness, I have a substance use disorder, and they tend to collide when you go in for treatment someplace. And it's been on my mind a lot. As a matter of fact, to the point that we just had our annual meeting Tuesday, and I had Peter Fifield come in and talk as our speaker for the annual meeting about that very issue. And so we'll be following up with him. For those of you who don't know Peter, he runs the Doorway here locally across the street from Lawrence Douglas. But we've got to get beyond that who or what is first and really start looking at this as a holistically and combined and treating both aspects. And it really doesn't matter, if you will, whether it was the chicken or the egg that was first.
Yeah.
Kind of irrelevant in terms of moving forward with that. So it's on our radar, and it's something we're actually putting some energy into and moving beyond that.
Thank you for raising both of those important points. We did have one or two more people. Yeah, go ahead. Good morning. Thank you for being here.
Hi, speaking in the microphone. So I have two questions. I can roll them into one. I'm gonna have them try to make sense. So as far as education and maybe potentially starting in middle school or high school, I heard the psychologist mention the social emotional learning. I've worked with residential with women for a year to 18 months, and it's been interesting. These women, some of them have been diagnosed with bipolar disorder, and then kind of tracking them through those 18 months, it's hormonal based behavior. So there's actually a thing called PMDD. So they're actually suffering from mental health challenges related to their menstrual cycle. I'm wondering if that's part of like our education system to recognize that that could be a possibility. And like for me, I have to say, oh, I hate myself. Everybody hates me, but I know it's all in my head. But it took me a while to get to that place and a really good doctor to pick up on that. So is that something we could incorporate into that? Sex ed, I don't know what we call it now. And then the second part would be. I did see the increase on the paperwork, but I believe, and I could be making this up, but in 2010, there was really a spike maybe nationally in these type of feelings and suicidal ideation and isolation, so related to potentially social media. And is that also in our social emotional piece where we're learning about people aren't really who they are on social media? I do community outreach in Rochester. I'm going to places, people are intense, people are living in garages, severe mental health, I know them, I've seen them online, they look like they have it all together. But they're calling the PD, they're calling me because they're so lonely and they're so isolated. So are we teaching our kids, this isn't real, like this isn't real and it's okay to reach out because we're actually all not okay.
Wow, I'm
So-
so glad you raised, yeah, no, it's great, and I'm so glad you raised the aspect of social media. This doesn't necessarily, I'm curious about it too, because I have children. It's not exactly, Christine, in the draft recommendations, what the schools are doing, but I do wonder how much getting real about social media is a part of the conversations and the trainings that you do at your schools and the school system.
So I would say it's addressed, but not enough. So, we definitely, in an age appropriate way, talk about screen time and social media and the impact of self-image related to looking at social media. That carefully curated Facebook life is not real for anybody, myself included. So we talk about it in health classes, health education classes, things like that. Probably not enough, in terms of having good boundaries on social media, but also not letting that be the thing that I call it packs your parachute, right? But you've got to be careful who packs your parachute because somebody may not know what they're doing. Well, if you're looking at everybody's carefully curated life and measuring your life against it and it doesn't measure up, you're measuring against a false construct. So I don't think we do enough of that. But we do talk about the impact of social media and the harmful impact of that. We know when we talk about things like body image and bullying and things like that, that social media has not had a positive impact on kids or adults.
I'm really glad you raised that point. Suzanne, when you do your both your youth and teen mental health trainings, does this issue come up?
A little bit, but not as much, just like what.
Maybe not
Christine said,
enough,
not
yeah.
But I have to say too, the schools do so much as it is. We really, again, I'm just gonna go back to taking personal responsibility as a parent. I mean, that's really our role, right? That's that we are first children's teachers. So as a society, where's that gone? So I don't mean to be high and mighty in this, but that's really what it is. I'm guilty of it. I mean, my kids all have phones and they've been on it for hours from time to time, more than they should be, but and I know that not all parents are equipped to be able. Not all parents are equipped to be able to be like that kind of parent, to be able to take that personal responsibility for it, because people have a lot of things going on in their life, but that's really what it comes down to. It's not just the school's responsibility, it is each and every one of us as a parent.
Any more questions from the audience? We have time for maybe one or two more from the online audience. Oh, yes, good morning, go ahead.
Yeah, we've talked a lot about like here and there tangible resources, and you guys are very tangible resources for the organizations that we're talking about and responding to the challenge. Sorry. I'm wondering if you guys could go a little more specific, maybe with events or possible volunteer or awareness opportunities that the community participate in concerning each of the organizations here, because you are the best resource, as the leaders of the organization. I know you touched on it already, but some more specific ways maybe can support.
That's fantastic. Thank you so much. That's great. And do you want to go first, Suzanne, on that, since you are sort of in charge of
Pointed at me.
community outreach?
I've all
and-
told her.
My boss. Well, the Dover Mental Health Alliance, we are always taking volunteers to come in. I mean, we are pretty much a volunteer organization. I've been fortunate because Community Partners has been supporting the efforts of myself with the Dover Mental Health Alliance, but we have events that we put on throughout the year. We have, I mean, I can't wait. I'm talking to an intern next week. I really need an intern. But there's lots of different things to become involved with, different subcommittees within the organization, things like that. And not to mention just Dover, but this is spreading outside of Dover. And that's really the intent anyways of the Alliance. We have work going on in Somersworth. We have work going on in Rochester. And they're, we're a little bit more ahead here in Dover, but there are definite volunteer opportunities to be working within this community organization. Let me get your email after.
And maybe that's something we could be more specific about in the draft recommendations, that seeking volunteers and interns to assist with these efforts. Yeah. I have one last question for all of you. Oh, go ahead,
Before you
Chris.
go,
Yeah.
So just where Suzanne was at, the Alliance, the concept of that is spreading to Somersworth and Rochester. We hopefully will continue that push, so countywide, and not to be too grandiose, but statewide, and then national, we can do something. Community Partners is in the early stages of starting to implement a mental health awareness grant that we got. It's a 5-year SAMHSA grant. And so we will be rolling that out. And so there'll be training opportunities, more training opportunities in Dover possibly, but also throughout the county, because that is the area that we serve. So whether you're from Dover, Rochester, Somersworth, Milton, Lee, Durham, doesn't really make any difference. We're going to have opportunities, and we'll be working with a variety of our partners in rolling that out. So
I'm so glad you asked that question. Thank you very much. And last one for all of you, and then I'll invite Professor Latona back up to wrap us up. And Chief Bro, to you first, but I want to hear from everybody. What are your hopes? What are your expectations for these recommendations now that the draft is out there?
Well, I hope that they're used, or the intent of them is to be used as a roadmap to help the individual city departments, but the community as a whole understand, where we're trying to go, what we're trying to do, that cultural change. And this is a specific roadmap to help that cultural change happen. So I don't think anything's going to happen overnight. I think, some things are lower hanging fruit. We're already doing a lot of it, but we need to continue. Some of them are very funding dependent. But the hope is over the next 1 to 3 or 4 years, we continue to do this. That I said it in the very first meeting. The hope was not that this is something we do and then we're done. This is really just a roadmap to help us stay in the right direction.
And how hopeful are you feeling that Dover will be able to stay on this path?
I'm very hopeful. I think everything in the report is obtainable. I think, the committee did a really good job making sure that we didn't put things in there that weren't realistic.
Christine, hopes, expectations, now that this draft is done and Dover moves forward?
I think for me, it's that all the city departments and community allies are working together instead of being standalone and, maybe potentially duplicating efforts, or there's pieces Dover Mental Health or community partners do. There's pieces we can do as a school system, and there's pieces that law enforcement can do. So that concerted effort about it being a community problem and the community working together to address it, I think is the big piece for me.
Yeah, I'm glad you raised that, because it is interesting to see that every department, the library says, oh, we can do this. And the schools say, oh, yeah, we can do that. And every department is kind of saying, all right, let's look at this and let's see what we can do. And I asked the chief the same question. How hopeful are you?
I'm very hopeful for a community to be having this level of conversation and bring out this many people on a Saturday morning at 23 degrees before Thanksgiving. It's hopeful for me that we're not in this work alone, and we have allies in the community that can help us move this work forward. When I look at the students in the school, the reduce the stigma piece is there. Our 16 to 18-year-olds are going to change the world in terms of mental health. They want to talk about it, they will talk about it, and they are not going to tolerate us not talking about it. So I think that's the most hopeful thing I can think of.
That's great. Go ahead, Chris, please. Your expectations, your hopes as this process moves forward.
I love what Christine just said. I really want to see the teen mental health first aid, but everything else that goes with that get into every school system. That's kind of my hope. Maybe it's grandiose, but it is by working with our kids who are going to then adopt a different mindset, and as they grow and they have kids and interact, it will continue, and we will have that cultural change. So I love that, and I want to be there. I think the other piece, Dover for me is an experiment. I think it's been a wildly successful experiment beyond anything I could have imagined. But for me, it's Dover, and then it's the county, and then it's the state, and beyond. I think if we can demonstrate this, years ago, when I first heard about mental health first aid, like grandiose thinking, I thought, wouldn't it be great if it was a requirement every year or every 2 years for our legislative body to have to go through a mental health first aid training, so that when they are looking at mental health bills or behavioral health bills, they have a different understanding of what is going on and the importance of the funding that they're about to vote on. So, and maybe I'm still grandiose with that, but I think what's going on in Dover, we got a chance.
Go ahead, Suzanne, your hopes and expectations from here on out.
This is an incredible report put together by some really incredible people, and with Max and all from the Center for Ethics at Saint Anselm's. And I don't want it to see it put on a shelf. I want it to be strategically worked into each of the departments in the city's plan, and then it becomes part of the overall plan. And then really, it's just part of our, I don't know if this is the right way to put it, vernacular. It's not like, oh, and then it's the mental health piece or it's the substance use piece. It's the language that we say, the things that we think about in terms of how we support our community. These things become automatic. That would be a wonderful thing. And it's not going to happen overnight. But it's not like it's like, oh, the mental health piece. Let's think about that. It's all part of who we are, what we need to do, how we should be functioning going forward. And I just want to say, I'm really happy we have some people from Rochester here today and Somersworth, and listening very, very intently. I know that because like I said, we're a little bit ahead in terms of the other towns, but we really want to make sure that we can support the efforts or in somehow consultative way or whatever, so that other communities can start to build their own vernacular around mental health and incorporate it and integrate it into their everyday life and how they run their city and schools and things like that.
Well, and that's what's interesting to me about these draft recommendations is there's a theme of supporting not just people who might be experiencing a mental health crisis or severe mental illness, but there is this awareness and openness to checking in on the mental health of everybody, because sometimes life is hard. So there's that comprehensive theme here. That unfortunately is all the time that we have with our panel. But I do want to ask Professor Max Latona to come back up to close out our event with some important information. So go ahead, please, Max.
Thank you. Thank you, Laura. And thank you to the panelists for a wonderful discussion and to our audience members for your questions. So let me just talk a little bit about the steps from here on out. Number one is for us to take the feedback we've received here and to consult and see what we can do for the report to incorporate some of that feedback into it. Also, again, I want to remind you that we're still taking feedback by email. What's the email again?
dovermha@gmail.com.
Okay, it's very important. So we'll take feedback through next week and beyond about this report and again, revise the report accordingly, because we do want this report to reflect the community, that there's community ownership over it. It's not just our committee, it's the community of Dover. I'm struck by some of the things that were said here, whether it's volunteer opportunities or facility or prevention, and particularly that prevention piece. I want to think about a little bit more in terms of the report. I do think the 6 objectives in some ways are aimed at prevention. When you're educating people and destigmatizing mental illness, that's a preventative measure. When you're training people to recognize when people are having an episode, that's preventing it from becoming a full-blown crisis. Coordinating with partners, communicating better can be preventative. Staffing, as we've seen with the police department, can be preventative and a facility. So I think that's there, but it's maybe needs to be made more clear that that's what's going on. There may be some additional things we can add. So those are some things that we want to do over the next week or so. Okay, so what's going to happen? We're going to present this report to the city council on the 30th and give them a chance to discuss it, consider it, offer some feedback. So our hope is that it will be adopted either as it is or some version of it by the city council. And as the chief and others have said, serve as a roadmap for the city and its departments going forward in the future. I can tell you from having spoken directly and individually with the department leaders, I am very encouraged that there is 100% buy-in. Every single one of them expressed an interest in helping the city and the community with their departments achieve the mental health crisis service objectives that we would like to. And it's different in every case. You know, the library, for example, offered their space for educational programs in mental health. Another office would offer mental health first aid training so their staff can recognize when people are in a crisis. There are many different ways each department could serve, but every one of them had 100% buy-in. So I'm convinced that this isn't going to sit on a shelf based on that personal commitment that these department heads suggested. So from that point on, so let's suppose that some version of these recommendations is adopted by the city council and the departments begin to work on this over the next year or 2 years. I would imagine there's an annual check-in of some sort by the city on how well the city is doing in achieving these objectives. And so that there's some kind of metric, if you will, of success and measurement. I also want to say this, our center has been thinking about this example that Dover is providing, and I think the rest of New Hampshire can learn from this. So we're thinking with the committee about how we might share what Dover has done, both in terms of its successes, but also its plans and hopes for the future with the other communities in New Hampshire so they could do something similar, because as everybody has said here, Dover doesn't live in a vacuum. And the issues that you're experiencing are being experienced by other communities in New Hampshire, and this can't be solved on its own. So the culture change that we're looking for ultimately needs to happen in each organization, but citywide, community-wide, and hopefully regionally and statewide. So we think what Dover is doing can help other communities in New Hampshire do that. So that's something we'd like to do in partnership with the city of Dover, share this model for other communities. So that's the long and short of it. So the first step is incorporating your feedback. Again, we welcome more feedback, presenting it to the city council and letting your city leaders take a look at it. Hopefully it gets adopted and then it becomes a plan going forward, some annual check-in, but then we'd like to share it with other communities in New Hampshire. So I want to thank all of you for coming out on a Saturday morning and all of our online audience. Hannah, we have people online, I take it. Thank you, all of you online, but especially our panelists for your insight and your experience, your wisdom, and Laura for your tremendous moderating skills. So thank you.